This is a sagittal CT through the cervical spine in a 16-year-old female with trauma. Notice already as we scan that there is mild prevertebral soft tissue swelling and edema. What I use is if it's greater than 5 millimeters at the level of C2 and greater than 15 millimeters at the level of C5, I call that prevertebral soft tissue edema. The salient findings in this case is here we see a posterior inferior fracture fragment at the level of C6. In addition to that fracture, we see a right superior articular facet fracture with extension into the pars interarticularis here at the level of C7. Notice that the C6 inferior articular facet is not fractured. However, we do have translational injury seen at this level with grade 1 anterolisthesis of C6 on C7. Notice that this is less than 25% of the width of the vertebral body. So the findings in this case are a fracture of the C6 posterior inferior vertebral body as well as a superior articular facet fracture of the right C7 with associated diastasis between the facets here at C6 and C7. This is an unstable injury, and it's important to order an MRI of the cervical spine to further elucidate the ligaments that are involved. This represents a posterior column injury due to the fact that there's diastasis of the facets as well as a superior articular facet fracture. In addition, there's a middle column injury because of the grade 1 anterolisthesis of C6 on C7. So anytime that there are 2 or 3 columns of the cervical spine that are injured, this represents an unstable injury and is warranted to get an MRI examination to evaluate the ligaments.